So we're just going to briefly talk about fundamental health needs in pregnancy, and we've got a bit of a visual here for you. So first and foremost, dentists. You will find that following your announcement of pregnancy right through till the baby's first birthday, you will be entitled to free dental care in the UK in NHS dental care providers. Dentist is important. We'd encourage you to attend. When in pregnancy, you may have a low level of vitamin D, and this can result in cavities within teeth, and also bleeding gums are very common in pregnancy. Vitamin D is highly important, and you would be advised to take a supplement of vitamin D throughout pregnancy and post-pregnancy as well, in terms of the postnatal period, especially for those of you who are considering breastfeeding your baby. In addition to that, you've got your antenatal care, the most important element really of pregnancy. Antenatal care is vital to understand the health and well-being of not only you, but also your unborn as well. Routine antenatal checks will consist of general health and well-being, along with blood pressure, urine and palpation of the abdomen post 26 weeks. Where we can then start to ascertain position of the baby, and we'll also listen into the baby's heart in terms of a handheld Doppler as part of that antenatal care that you receive from your midwife out in the community. In addition to that, your maternity clothing, more specifically bras. We'd expect women to be wearing maternity bras from around 16 weeks. This is when the breasts are starting to develop, starting to change and take a bigger shape, ready in preparation for those of you who are breastfeeding. You may already notice significant changes to the breast, becoming larger, nipples becoming larger, and also darker around the areola as well. In terms of bras, maternity bras are designed to help fully support the growing breasts, but also remove that underwire which could cause further damage to the tissue found within there. On top of that, we'd expect a balanced diet, making sure that all core food groups are met, so your fresh fruit, fresh vegetables, proteins, iron, etc, etc. But also bearing in mind that actually your calorie increase only needs to increase in the third trimester, so that whole eating for 2, eating for 3 is only a little bit of a myth, but by all means, if you want to do that, then that's your choice. Average weight gain is around 2 stone in pregnancy, take into account the average birth weight's now around 7.5 pounds. Still quite a lot of weight that's gained throughout that, and is something that your midwife will monitor throughout your antenatal care as well. On top of that, hydration, making sure you stay as hydrated as you possibly can. Hydration plays an important part not just for you but also for your baby in terms of the amniotic fluid surrounding the baby. High levels of hydration also reduce the risk of water infections. Water infections in general are very common in pregnancy. However, we wish to reduce them as much as possible because they could potentially lead to preterm labour.